Well, the number of infections on the Diamond Princess cruise ship has doubled in a single day to 135, but Japanese authorities say it would be too difficult to test all 3,700 people on board that ship. The Diamond Princess is leaving port in Yokohama, Japan, for what the captain calls normal sea operations. One of the passengers quarantined on the ship for the past week explained how she and her family are passing the time.
We've been doing a bit of stretching and exercise in the room just to make sure that we're keeping a bit healthy. I've been chatting to a lot of family and friends. A lot of messages coming in that they're keeping me preoccupied and just chatting with them. We've got reading, we've got movies to watch. The kids are doing a lot of social media stuff with friends, chatting with friends and surfing the internet with their smart devices.
And CNN's Matt Rivers is live this hour in Yokohama. He joins us now. So, Matt, how are authorities explaining the doubling of infections on the cruise ship? And what happens now with the ship leaving port? What's the logic behind that move?
Yeah, well, Rosemary, I mean, in terms of the number of cases going up, what authorities are saying is they have no way to know how many people ultimately are infected on board this ship. You know, we haven't had any new cases reported yet today, although we haven't heard from government officials yet. But there's no way to tell day to day how many new cases are going to be declared. What the government does say is that any new cases that are going to be declared, these people contracted the virus before, government officials say, the quarantine began. They do not believe that any of the cases, even though 65 people yesterday additionally were reported to have this virus, they do not believe that any of them contracted the virus after the quarantine. They believe the quarantine is working. That's their line, and they're sticking to it. As for these normal sea operations, we saw this a couple days ago as well. The ship has to go out, to do normal maintenance functions, as they say, including the production of fresh water. They take about 24 hours to go out, and then they come back. So we are going to see that later today. It's been taking a little while, though. They were supposed to leave hours ago, but they're still taking some of the people that are infected off of this ship. As far as the tests that you mentioned, it is going to be an uphill battle to test all of the people on board. It's one of the things I spoke to about with one of Japan's vice ministers of health. I spoke to him yesterday evening. Here's what he had to say.
基本的にその19日になって
We understand everyone is anxious. Spending 14 days in small spaces is very difficult. So we need to take care of people, especially those with pre-existing conditions and the elderly. We're doing our best to be ready and test those who are higher risk first, and then bring them to special facilities should they test positive.
How challenging has this been for your government to try and deal with a problem that is not of your making?
なんですかね、いろんな国の
This ship has many nationalities on board, so it's a problem involving many countries. They're all asking for our help, so we have to take responsibility for this. Our primary goal is to prevent a pandemic in our own country. But at the same time, we want everyone on board to get home safely. So Japan can't do this alone. We need lots of cooperation from other countries to make this work.
Now, the United States has sent a representative from its Centers for Disease Control here to help monitor this situation. But, Rosemary, we are expecting the number of cases on board this ship to go up. It's a 2-week gestation period. And even if these people contracted the virus before the quarantine began, officials are collectively saying they do expect more cases to be reported from this ship. It's just a matter of how many people will be declared positive with this virus. But as of now, no plans to end this quarantine later than February 19th.
All right, very frustrating for so many people on board that cruise ship. Matt Rivers bringing us the very latest from Yokohama. Many thanks. Well, pharmaceutical companies are now racing to develop a vaccine for the deadly virus. GlaxoSmithKline is among the companies leading that charge. Its chief medical officer tells CNN he thinks a vaccine is still 12 to 18 months away, and that's being optimistic.
Normal vaccine development indeed takes 8 to 10 years. However, what has happened over the last few years that the time period between starting the development and have a candidate in hand has dramatically been reduced. So we can have vaccine candidates in hand within 3 months, and 2 companies have already announced they have vaccine candidate. However, what takes longer is testing the vaccine in humans, because we have to make absolutely sure that the vaccine creates an appropriate immune response and is safe, and that takes time, and therefore under optimistic circumstances, I would guesstimate it takes 12 to 18 months until we have a vaccine ready for use.
And researchers in France are part of that global push to develop a vaccine. CNN's Jim Bitterman takes a look at some of their efforts.
As infections and death tolls mount from the coronavirus, the pressure is growing on the scientific community to come up with answers to help fight the disease. Some of the most important laboratories in the world are involved in the coronavirus crisis, including here in Paris at the Institut Pasteur, named for Louis Pasteur, the 19th century doctor whose name is synonymous with the development of vaccines and treatments for diseases. And while finding a new vaccine against the virus is the ultimate goal, it could be months or even years away, since it will require animal and human testing before it can be deployed. What's more urgent for the researchers here and elsewhere is developing tests for coronavirus antibodies, which provide early detection of infection, since patients can be contagious and spreading the virus without showing any symptoms of sickness.
This is actually quite crucial to know how virulent this new virus is, what is the true rate of mortality associated with this virus. And it is also essential to understand the risk of contamination from people who would be little symptomatic.
A second priority for researchers is finding a treatment that can slow or stop coronavirus infections from the existing treatments, repurposing other drugs which have already been tested and approved for other diseases if they can be effective against the coronavirus.
Alors notre objectif, c'est bien évidemment de...
Our objective is to evaluate and hopefully validate these repurposed medicines very quickly, in a matter of a month or a month and a half, to propose them as therapeutic solutions for patients.
Thérapeutique. In the morning, when I wake up, first thing I do is to go on Twitter. On Twitter, I'm following the top virologists, top mathematical modelers, and phylogeneticists.
What scientists say has worked far better with the coronavirus outbreak than in previous pandemics is the amount of sharing that's going on. Since early in January, when the Chinese were able to put online the genetic code of the virus, scientists around the world have been able to conduct their own research. But despite the collective efforts of some of the top infectious disease experts in China, Australia, Great Britain, France, and the United States, there is, as of yet, no antiviral treatment against the coronavirus and no vaccine to prevent it. Jim Bitterman, CNN, Paris.